very excited to announce Sami Soliman from AT University, Arizona.
Thank you for having me today. My name is Samah Solomon. I'm a D3 at ATSU ASDOH in Arizona. So the dental school Lyfe and my DentalLyfe. So if you are on Instagram, Facebook, or YouTube, you know that I have my DentalLyfe blog, and I post a lot of stuff on there that's very beneficial, and I'm very transparent, as you'll see in this presentation. And this is my contact information, my email, and my handler for my social media. I was the former ASDOH pre-dental director, and I was also the former ATSU interview student ambassador. So with these two positions, I was basically responsible for having any relationship with other clubs that are pre-dental across the nation, basically. And with my student ambassador, I used to be present during the interview days when they used to be in person. Unlike this cycle, because of COVID, now the interviews moved to online. And I was the former president of MESA, a club that I created, the Middle Eastern Student Association. And that club is basically, I created it to be inclusive of everybody. I got my bachelor's in neuroscience from UC Riverside in 2017, and I have been a dental assistant for 8 years. So dentistry is my cup of tea. And anything that I will share in this presentation, or basically any presentation that I give, is my personal experiences. You can use it, completely up to you. It's just a guide. It's not a guarantee that you will be successful, you get into dental school. Just I want to use my personal experience because I think it's unique to me to inspire other people to keep pushing forward and have a purpose in life, just like I do. So my dental life. So your story matters, and I think my story matters, and that's why I'm sharing it. So dear all of you guys, if you're reading this, I hope that I can inspire you today for your empowerment, dental life. So this right here is my non-traditional background. So non-traditional is basically a student that doesn't take the post-high school route into a professional program such as PT, PA, doctor, dentist, you name it. They take the longest way possible. And I think if I had to go back and redo everything, I would probably do it the same way, because the path that I took got me to this point in my life today. And with all the experiences that I encountered, I think they influenced me in the most positive way. And it just provided a lot of personal growth along the way. It was probably the longest way to go about getting to where I am today, but I would have not have done it any other way. So this is a little boomerang of me when I was in Egypt last summer break. And so I immigrated from Egypt in 2004. And ever since, I have been living the American dream. And when I came to America, I spoke zero English. I had to learn English as a second language when I came here. And my purpose, or the reason why I excelled in English and I had to motivate myself to improve my English is I was helping my parents because they spoke no English at all. And in 2007, I think I was finishing up my middle school. I watched a movie in social studies called PayItForward, starring Kevin Spacey. And you will see why that phrase, pay it forward, has stuck with me ever since. And I graduated high school, Oak Hills High School in Victorville, the high desert in California, in 2011. And during my senior year of high school, I enrolled into an ROP program, Regional Occupational Professional School, basically. And it's, in a nutshell, it's basically a trade school to get you prepared for a job post high school. So once I got the certifications, I applied to get my RDA license with the state of California. And with that license, I was able to do more functions or more duties as an RDA, more than I could have as a dental assistant. So a side note, a lot of the states have different regulations as to what a dental assistant can and cannot do. So you have to follow your state's guidelines. That way, the office that you're working at or assisting at or shadowing at does not get fined. And it's a big fine. So just follow the rules, basically. And then in 2015, I graduated the community college with 2 associate degrees, one in liberal arts and the other was in math and science. And then in 2017, I graduated UC Riverside with a bachelor's in neuroscience. And in 2017, upon graduation, or before graduation, I didn't want to take a gap year. I wanted to apply and get into dental school right away. So this is my mindset. It's my ignorant mindset back then. I had the mentality that, oh my God, I have like 7 years of dental assisting experience. I don't need to do well on the DAT. Stats are not everything. With my clinical experience as a dental assistant for 7 years, that is going to be my free ticket into dental school. And boy, was I wrong. I literally, as far as like the application, the personal statement, the business inventory statement, and all that, I didn't give it my all because I relied on one component, being a dental assistant. And that backfired because I got 0 interviews and basically 19 rejections from all the schools that I applied to. Some of them didn't even bother looking at my application. So I did the only thing that I can do is take a gap year. And honestly, I think that gap year literally gave me a lot of time to reflect back on what has went wrong, and for me to realize what I did and what I can fix and what I can work on in these 12 months leading up to applying again. So with that being said, I applied to 20 schools the second time. I got 4 interviews, 3 wait lists, and 1 acceptance. The acceptance was obviously at ASDOH. And in 2018, I met Dr. Jeffrey Eaton at UCSF, and he is literally the best mentor I can ever ask for. So a side note for all the pre-dents, that their pre-dental society or club do tours at dental schools. Make sure you go onto these tours and get out of your shell, your bubble, or whatever, and talk to doctors, professors, people in admissions, and put your name out there. So I literally met Dr. Eden. I was just an introvert a couple years ago, and I was like, okay, let's see if I can have the courage, summon up the courage to talk to this guy. And I did, and it was the best decision that I could have ever done, because he was the one that wrote me a lot of recommendation about community service for AADSAS, for the secondaries. And I honestly don't think I would have got in if it wasn't for that guy. And since then, you'll see his pictures throughout the presentation and how he inspired me to implement the PayItForward mission. So in 2018, I matriculated at ATSU ASDOH, and it's the best dental school. And like Dr. Eden said, the best dental school is the one that accepts you. And boy, he was right. So in 2018, I created DentalLyfe, my dental blog, after the ASDOH National Leadership Conference in Chicago. I was inspired by a lot of the speakers there. And I'm like, oh, I want to do that for a living. I want to be basically doing what I'm doing right now, talking to other people, inspiring them, telling them my journey, sharing my stories, and just being transparent overall with everybody. And then I talked already about my positions with AADSAS, with ASDOH, like what I did as far as the pre-dental director, the ambassador, and the president of MESA. And then at the end of 2019, I went to Thailand during spring break. And summer break, I went to Egypt. These were probably the best 2 decisions I have ever made, because I needed to detox. I needed to just get away from this city, from the school. I wanted to just basically do a getaway and just push restart or reset and then come back refresh. So I highly encourage people to do that. Once you get accepted, have some vacation. I know it's difficult with COVID and whatnot, but just try to find time for yourself and have some leisure time after the DET, after the application process, of course. And in 2020, because of COVID, I started the PayItForward mission. And this meeting is technically a part of my PayItForward mission, because that's what I'm doing. I'm paying it forward and I'm sending the elevator back down to all of you. This time frame between getting my dental assisting license, I worked in 20 offices or more, probably more than that. I worked as a dental assistant, front desk, and also as a lab technician. So for me, I wanted to be versatile. I wanted to know a little bit about everything, because I want to have a successful practice once I graduate dental school. And that is my vision. I want to know what goes behind the scenes. Like my hand skills, I'm not worried about that. I think sufficient enough. I put in a lot of hours to make sure that my hand skills are top notch, but the administration that goes behind it. Because if the administration is not successful, then your hand skills really don't matter. You're not going to have a successful practice if that's the case. So it's not the destination, but the journey that matters. So this is a quote that I really liked, because it says the journey into self-love, self-acceptance must begin with self-examination. Until you take the journey of self-reflection, it is almost impossible to grow or learn in life. In a nutshell, this is saying that from my personal experiences, dental school is hard, but it's not impossible. I had to force myself to learn self-love, self-examination, accept myself, and most importantly, forgive myself. Reflect on the journey throughout the journey itself. So have some you time or me time, and just take a couple steps back and then kind of view the past couple months. How was my performance in whatever you did? And I think that will benefit you a lot, because at the end of the day, you grow through your struggles. So the big question, why dentistry? So this right here is my beautiful mother, Hanan, and she is why I got into dentistry. So this is at my graduation back in 2011, my dental assistant graduation, and this is me at her graduation in 2017. So this is a woman that did not speak much English, but still managed to get a degree as a dental assistant. I helped her a lot, and my younger brother also helped her a lot. But just what she had to go through and how much she inspired us and how much we inspired her literally showed us how committed we are to the profession. But by we, I say me, her, and my younger brother, who is a pre-dental as well. So why dentistry? So my mother had a big toothache when we were younger, and I remember her having the toothache and having root canal treatment and another retreatment of that same tooth with another root canal, and then eventually having that tooth extracted. The pain was so severe that she ended up having a piece of cloth around her entire neck, and she was literally walking around the house with that. The image is just very vivid. And just me being a young kid, I told her, I'm going to do something about it. I'm going to be your dentist. And since then, here I am fulfilling that promise. And this is my beautiful mother in 2018 during my white coat ceremony. And I really love this quote. It says, "All I am, I owe it to my mother." And I could have not said it any better. So what is DentalLyfe? So this is Dr. Clamshy putting the white coat on during the white coat ceremony back in 2018. And a lot of the pictures that I'm going to be using, by the way, is directly screenshots from my Instagram. And this is how much I put out there, because again, I really love to share my story. And if it inspires one person, then I think I did some good to other people, and I inspire other people to pursue their dreams and whatnot. So DentalLyfe, so this is the first logo that I made back a little bit over a year ago. And I literally sat back, and this caption reads, "A clear vision supported by sacrifice and hard work gives you the wonderful feeling of confidence and personal empowerment. So be true to your vision and what you love doing." I have been wanting to create something like this for years now. If you can see it, you can manifest it. And yeah, this is basically my quote unquote brand. that I'm trying to put out there. And because of the education that I'm getting at ASDOH, Arizona School of Dentistry and Oral Health, and I'm also doing a dual degree. So I'm getting the DMD from ASDOH, and I'm also doing the MPH program, Masters in Public Health, because I think I can do way more good with a dual degree with an emphasis on public health here in America and back home in Egypt, and just basically giving back to the village where I was born in. And the tagline for my DentalLyfe is, "Your oral health is vital." So that's why you need to take care of it. And just the design of it, I'm very proud of it, because it's a tooth and it's basically the heartbeat. So that's the vitality of the tooth. So there's a lot of thought that goes into what I do, and I just put my heart and soul in everything that I put out there, and I'm honestly proud of it. And like I say, reflection, reflection, reflection. So this is me with my classmate Angelica back in 2010 when I was a student for my dental assisting program. And this is me last year with my classmate Steven taking the x-rays. So I took an x-ray as a dental assistant, and again I took x-rays as a dental student. So if you can ask me, it's the same exact guy, just the guy that's on the top is a little bit more introverted, even by my posture. The guy at the bottom is a little bit more extroverted. But at the end of the day, I still have the same heart and same inspiration to pursue dentistry. Nothing has changed there. So a couple things that I want to share about DentalLyfe and why I created it. So these are my core beliefs. I strongly believe that a person's journey can have ripple effect by inspiring others. I strongly believe that your oral health is vital to you. I strongly believe that there is always beauty in the struggle. I strongly believe that every delay has its blessings, as I strongly believe that you need to start by placing one brick at a time, so eventually you will have a wall. And that is a motivational speech that I watch over and over again by Will Smith. If you get a chance, watch it. It's on YouTube. And he basically says, if you want to build something great, you need to first lay a brick. And that's what I'm doing by creating this DentalLyfe, is laying a brick at a time and then seeing what result I will have at the end. So what is my PayItForward mission? So PayItForward is actually a book, and it was made into a movie starring Kevin Spacey. It inspired me to create something. So during COVID, I'm going to be talking a little bit about COVID in this presentation. So I basically made this grid of videos that I wanted to do to help pre-dental students get into dental school. It goes over applications, it goes over DET, it goes over interviews, and I did the first probably 12 videos I have so far up, discussing my journey, my dental life, and I had an interview with Dr. Eden. And I did all the videos that are necessary for you to create a successful application for dental school. And that was my phase 1 of this PayItForward pre-dental series. And the second phase will be DET preparation, and then the third phase will be for the interviews. So right now, because I'm taking a licensure exam in a couple weeks, and I have been just super busy with that, and the people on my team have been, some of them are D1s, they have been starting their dental school. So the project is on pause for the time being until everybody is ready to continue moving forward. And again, every delay has its blessing, because I rather produce something that is of value than just rush it and put it out there. I want whatever my team and I create to be a product of love and passion for dentistry. So this right here is some of the videos that I have on my YouTube channel. So basically, some of them are the best AADSAS dental application overview. We go over supporting information, such as your resume, your extracurricular activities, your experiences, your personal statements, your disadvantage statement, how COVID is affecting the cycle, and you name it. And even the supplemental application, we have a video for that. And this is my Instagram feed. I had an entire series, and also the videos are posted on YouTube and also on my Instagram, IGTV. So you can check them out. I really love the concept of 3 favors for 3 other people. That's all I ask you guys and challenge you guys and encourage you guys to do. Just do 3 favors for someone else. It doesn't matter if you know them or not, and see the ripple effect of that. And my goal is to inspire others and be inspired by others. I have been brainstorming this Pay It Forward series since last summer, but because of COVID, I finally had the chance and the time to create this project. The best thing is to send the elevator down. And I talk about this in one of my very first videos. Sending the elevator down is, a lot of people have the misconception of sending the elevator down. People sometimes think I'd rather be at the penthouse and send the elevator down when I'm in the penthouse. Penthouse meaning like I'm a dentist now. I can finally help people out when I'm a dentist. I respectfully disagree, because the way I see it is I rather help others and send the elevator down at every level. First floor, I send the elevator down. Second floor, I send the elevator down. Third and fourth, until I graduate. So that is my, I think that is my mission, to pay it forward and send the elevator down to help others, is at every level, every small progress that I make in dental school, I want to help other people, because at the end of the day, that is a big motivator for me to keep pushing forward. Because again, dental school is hard. And doing this for everybody, I think it inspires me. It gives me that fuel to keep pushing forward. Speaking of forward, when you fall forward, because you are gonna fall. It's a reality check, and it's better to hear it than to experience it. But at least now you kind of anticipate, if you fall, just remember, fall forward. So Denzel Washington is one of my biggest motivational speakers. He says, nothing in life is worthwhile unless you take risks. Fall forward. Every failed experiment is one step closer to success. And I couldn't agree more. And with that being said, the failing forward, I had my fair share of failures. Before dental school, I had my fair share of C minuses, Fs, you name it. And in dental school, I also failed a couple classes. And that is completely normal, because it makes me more resilient to anything that happens. And like I always say, I rather fail in middle school than high school. I rather fail in high school than in college. I rather fail in college than in dental school. And I rather fail in dental school than failing my patient, my life patient. So it kind of, that mentality always has stuck with me, because we are all human. We're all vulnerable. We are all flawed. We are going to eventually make mistakes. We're going to eventually fail. It just dust yourself off and keep moving forward. Just keep swimming, like Dory says. So this is my wonderful Pay It Forward team. So I started it. So Sylvia, she's a D3 at ASDOH. She's my classmate. Dr. Jordan Burnett, he's a UOP, alumni, University of Pacific, the only 3-year dental school in the country. He just graduated this year. And then this is also my other friend, Fernanda. She's a D3 at UCLA. So we have a variety, like you'll see, of students that are helping me with this project. So I have Neda, she's a D1 at Western U. I have Maret, she's a D1 at OHSU, and Niveen, she's a D1 at Western U as well. And then I have my brother, Habib Salman, who's a pre-dental tooth tip consultant, Brian Ibrahim, who's also a tooth tip consultant, and Kiro Basili, the same. So as you see here, the way I have it is it's a strategy, because I think having a dentist, they're kind of like inspiring me, helping me, and then having current students that also help me, and then having D1s that are helping the pre-dental students, having the pre-dental students. So I know Habib, Brian, and Kiro are helping other people with their application process as they are filling their own application process and helping others with their DET as well. So that is basically what is Pay It Forward is about. I helped each one of them in one component or another. And all I tell these people that I help is, if I help you, I don't want anything in return. All I ask you is, when I need you to help someone else, I'll be sending someone your way eventually, and I'm going to ask you, because I'm not going to normally have time to help others. I'm going to send people your way. Please, if you can, make time to help them. And every single one of them has fulfilled the PayItForward mission, basically. And this is an amazing quote, because of just like what I said. No matter how successful you get, always send the elevator down at every level. So why ASDOH? So I got, like I mentioned, I got 4 interviews. One of them is Nova in Florida. The other is Loma Linda in California. And the other was Western U in Pomona, California. So I got all the interviews. Western rejected me. Nova, Loma Linda, and ASDOH waitlisted me. ASDOH accepted me. And that is why it's the best dental school in the nation, because it's the one that actually saw you and the one that wanted to take a risk by accepting you. And that you guys should not take lightly, because every seat in dental school is worth something. And you will see, they tell you during the white coat ceremony, look to your left, look to your right, make sure that these same people are there during graduation. Help each other out. And when life happens, sometimes 1 person or 2 people don't make it through dental school, and it's the saddest thing ever, because that's an empty seat there. But that's why I'm trying, if I can intervene and I can inspire people before getting into dental school, then I can ensure that they can successfully complete dental school. So for ASDOH, so the ATSU, AT still is Andrew Taylor Still. He is the founding father of osteopathic medicine. That is an interview question that was asked during the discussion, and I was the only one during my interview day that knew what ATSU stood for. A lot of people thought Arizona is part of the name, but no, it's Andrew Taylor Still. So with that being said, make sure that you do your homework on every school that you go and interview at, because they will ask you questions about that program. And at ASDOH, we have various programs. I'm just going to name drop a couple of them. We have EBD, which is evidence-based dentistry. You use evidence and research to base your treatment options and your material selection as well. Like, what kind of material should I use? Composite, should I use amalgam on this patient? And what crown should I use if they have a heavy bite or if they grind their teeth? Everything that we do in dentistry has to be backed up by research, and that class is important for that. We have another class called DIC, Dentistry in the Community. I'm going to be talking about that in a little bit. We have CDR, Collaborative Dental Rounds. That is basically the intra-professional education, meaning that the D1s, 2s, 3s, and 4s get together in groups and have a patient case study, where basically it's a group discussion. It's basically make a treatment plan and go over the case together. And it's good because you kind of get to pick the upperclassmen's brains. And as an upperclassman now, as a D3, I get to help the lowerclassmen. And then the other thing is IPE, interprofessional education. That basically means that you are talking to other professions other than dentistry. So let's say their physical therapy, their MD, their pharmacist, their cancer hospital. I'm going to be talking about that in a little bit also. And just various professions. You just need to be able to communicate with other professions, not just about teeth. The other thing is Seman 3G is basically a live human being that is basically a robot, and it has feelings, it cries, it has saliva, it has a heartbeat, and we get to practice on that before actually practicing on each other. On every one of our classmates, basically. ASDOH campus, the clinic floor is divided into 4 comprehensive care units. We call them CCUs. And that basically, each CCU has 2 directors, and they have about 15 to 20 students in every CCU. So that's a little bit of just a background about ASDOH. So ASDOH, we also have GCAS, which is Give Kids a Smile. It's held every February. ASDOH holds the biggest GCAS in the country. And it's a day where we get a bunch of kids, probably over 300 or so kids from around all over Phoenix, come to ASDOH and we give them free treatment, basically. And first year of dental school, as D1s, we get to dress up. So I dressed up as Drew's brother. We have our minions, of course. And this is my brother, Habib Neda, who is also, so Habib and Neda are part of my PayItForward team. Samira is applying the cycle, so hopefully she gets in, and then I know for a fact she most likely will be joining our team as well. So right here, this is DIC, Dentistry in the Community. So ASDOH gives you the flexibility to be as diverse as possible, and it respects everybody's background. So here I chose to do the DIC project at my church. A Coptic Orthodox. My classmates and I, and then also a pre-dental Ramiz, ended up coming and helping me out with the project to implement it. We basically had a oral health day with the kids from pre-K all the way to middle school, I believe. And we basically showed them the importance of oral hygiene, how to brush, to floss. We gave them a pre-quiz and a post-quiz to kind of test their knowledge and how much our presentation impacted them. So I love that because I literally took it to our directors and I'm like, this is a side that I want to do it. And my partners were on board with it because I told them that I believe that my community needs a lot of oral health attention. Here is me giving the M&M, the Mentee Mentor Mixer at ASDOH as an ambassador. This is also as an ambassador at ASDOH pre-dental day last year. So my brother was one of the pre-dental students that came in that day, and we ended up opening SIM clinic and giving them hand pieces and plastic teeth, and he was just drilling away, and it was a lot of fun. And this is Dr. Jeff Eden, the mentor that I told you guys about. I ended up inviting him to Arizona to come and give us a lunch and learn. So this is Dean Jack Dillenberg. He's the inaugural dean of ASDOH. And I think he retired like 2 years ago. So he was visiting SIM clinic, so I had to take a picture with the famous guy. And this is our vice dean, Dr. Wayne Cottam. He's also our head and neck anatomy professor. And as the president of MESA, Middle Eastern Student Association. And I got creative with the name because MESA in Arizona. So I kind of got, I took creative liberty of doing that. So that's the club that I made. And over here is Azra Bab. She's actually the admissions coordinator. She's the one that replies to all your emails and whatnot. So she was on board to be our club advisor. So this is an article that my brother and I co-wrote after visiting Egypt. And this is our beautiful grandma, and how her oral health was deteriorating, and how our village or our community back home needs a lot of help. And that is part of the reason why I wanted to pursue the Master's in Public Health, because I wanted to give back to this community in America and my community back home as well. So right here, this is the quick profile of ASDOH with their contact information, website, phone number, and the admissions email. And everything that I have here is literally anything that you can Google yourself. Make sure that you use Google. It's an amazing resource. It's probably the most underused resource. And this will give you kind of a quick statistics about, or facts about each program. And each school has its own like website and different layout. But I encourage everybody to do that. And please call each school and ask them questions or email them. Make sure that you get on the school's radar, so that way they have your name in the system and they know who you are. Otherwise, you're just another number in their system. So COVID versus dentistry. And this is basically, I'm going to talk about how that affected our profession. And affected has a very negative connotation. I'm such an optimist. I like to look at the positives in every thing that happens. And I think it actually affected our profession in some form in a positive way. And this is a map by Johns Hopkins University and Hospital, and it basically just shows the pandemic at work. This right here is a graph from an article that was released by the New York Times, showing right here the exposure rate and how each profession, where they stand with the exposure rate. And of course, dentists and hygienists, they have one of the highest exposure rate because we are really up close and personal with our patients and with our team members as well. So that kind of was a big red flag for dental schools, and that article I think was one of the important articles that put everybody on alert. But with that being said, we are here on Zoom University, and a lot of the dental schools went online for a couple months until the proper PPE, which stands for Protective Personal Equipment, was in place. And each school felt they have the sufficient PPE to bring the students and the faculty back to start working. And everything was done in phases, gradually, so that way we'll minimize the exposure and the spread of COVID. And I think our school, for the most part, has done an amazing job. We literally had one, I believe it was during spring break. We had 1 week off, and within 1 week's time, everything was turned upside down, and they figured out how to implement all the Zoom lectures from home. And props to just people in our administration, just across the nation, not just at ASDOH, at every education institution, because there's a lot of stuff that goes behind the scenes. And yeah, so these are some of the pictures of me wearing PPE. So different gowns depends on whatever they have that day and whatever treatment I'm working. If you're working on a live patient, it's more PPE. If you're working on mannequins or just in sim clinic, it's less PPE, because we want to reserve these PPE for when you are working on actual patients, which makes sense. So this is me getting ready to work on a patient. To do a cleaning, I have N95, and then I have a surgical mask on top of that. And then I have face shield, head cap, and then the gown and gloves. This is me after the treatment. I took the N95 off and the surgical mask. And I'll tell you, N95s are not nose friendly. They kind of suck even after you wear it for a couple of hours. They're just unbreathable. That's probably the best way to put it. And but you got to do what you got to do. Hopefully things settle down and we have a new standard of care. Hopefully all that is sorted out soon. So this is one of the patients during my pedo, my rotation. And this is Dr. Preach, our pedodontist. I had permission and consent to post this picture by the mom. And that was a really good rotation because I got to do my first extraction on a kid, not this one, another kid. And this is a clinical evaluation that was posted on my account by one of our clinical directors. And I didn't know I was being evaluated. I was just doing what I do best, just provide care for the patient and kind of make up for lost time, because COVID really affected patients in a bad way. Because if your patient is put on a certain schedule of cleaning and they have a lot of gum disease and all that, and COVID came around and they screwed all that up. So your patient's timeline was supposed to be coming in to our clinic every 3 months to get a cleaning. Now, 6 months later, they're coming in. So they skipped basically 2 sessions. So that affected them. So I'm trying to be as gentle as I can and as friendly as I can. And it paid off, because the note that I got really put the biggest smile on my face. It reads, very thorough and well organized. This is going to set you up for success. Great job today. It was a pleasure watching you interact with your patient at a such professional and very caring level. And I really appreciate that. I ended up going and thanking that faculty for saying these sweet words. I strongly believe that tough times make for even tougher people. I think that is one of the best things ever. And all you can do, honestly, is just roll with the punches. I really love this picture because it's just, I think it's hilarious. So I'm gonna go over a sample of my week schedule during COVID. This is this week's schedule leading up to literally right now during this meeting. This is my calendar. So I started off the week, Labor Day weekend. I went over patient's chart for the week. So I had the SNCU. The SNCU is one of the rotations. It stands for a Special Needs Care Unit, where we take care and treat patients that have special needs and disabilities. And on Monday, I went over the patient's charts for the week. And then at night, I went out with friends to watch the movie Tenet. I highly recommend that movie. I'm not getting paid to say that. It will mess with your head a lot. And it's just, I think, and that was actually the first movie that I saw in theaters since quarantine started back in March. So yeah, if you're comfortable going to see the movie, me and my friends, I think only 5 people were the only people that were in theaters. So and they tell you to come in with your mask on as well. So that was pretty cool. And on Tuesday, I ended up assisting our residents with a mandibular tori removal. So mandibular tori is exostosis, extra bone basically on the lingual side by your tongue. So the patient was treatment planned to have a denture, a lower denture, and we can't see the denture with the bone in the way. So we had to reduce that bone down. So this is basically before and after. This is not the patient that we saw, but just to kind of give you an example, and this is after. So basically that entire bone was reduced or removed, and that helps with the patient's oral hygiene and just taking care of their dentures moving forwards after the treatment. So I helped one of the advanced education in general dentistry AEGD residents because at ASDOH we have a residency program, and it's the best thing ever because I get to assist and work with other dentists from other programs and kind of get to see how they were taught at other programs across the country. And now they're at ASDOH, so I'm kind of like showing them how we do things here, and they're showing me how they did things at other programs. And it's all about the communication, going back and forth with just people that you work with and interact with. I think it goes a long way. And I basically told the resident at the end, like, she was just like very impressed by herself that she did that because it was the first time that she did it. And I was basically cheering her on, and I knew that it was her first time because she was a little bit nervous, but it kind of reminded me how I was during my first treatment. I was a little bit nervous, but again, you just have to get in there. You stayed up late to study for this, you know what to do and how to do it. And I also gave injections on this patient for competency, so that was pretty fun. I got that signed off. So I wasn't assigned to this patient. I had to hustle, and I had to go out of my way to find other stuff to do because it was a slow day. And that's what you need to do once you start your clinical experience, is to get out there and be as of much help as possible to other people. And that way you gain so much experience, because I literally talked to other residents and doctors, and some of them have never seen a tori removal, and I have a dental student. So that just puts you ahead of everybody else. On the 9th, I ended up assisting also another resident, and actually the periodontist, the specialist for a gum surgery. The patient had very deep pockets, and they had period disease on the molars, and the doctor did the entire treatment and all that. And then at the end, he was checking how wiggly the tooth was, and it was very wiggly. So he called it off, and he basically told the patient that this tooth cannot be saved and we need to take it out. So that taught me how I need to set up the patients for success by telling them the worst case scenario. Like, I rather have the patient know that this is a possibility. I'm gonna try my best to save the tooth and make sure that you have good dental health. But worst case scenario, once I get in there, once I flap, I open the gums and see what's underneath there, because I can't see that because I'm only looking at an x-ray at 2-dimensional. But once I get in there and look at everything 3D, everything changes. So you leave the patient with the possibility with a worst case scenario. And since the patient was set up for success, they were like, oh, you're sure that that's what's going on? And we were like, yeah, it's just, we did everything that we can to clean the tooth and to save it. And you have to lose a tooth. And the patient was like, okay, take it out, just like that. But if you did not disclose this with the patient, and this is honestly why a lot of patients hate the dentist, is because a lot of dentists don't go the extra mile and disclose extra information with their patients. Because if it was me and then the doctor didn't disclose the fact that there might be a worst case scenario, I would have thought that the doctor made a mistake and he broke a tooth or whatever, and that's why they need to take it out. And this is why you need to save your behind by explaining everything as thoroughly as possible to your patients. And this is a step picture. So this patient basically doesn't have any bone right here. We retract the gums. We add extra synthetic bone basically, and we put some membrane on it. We put sutures, stitches, and then the patient heals. And now the patient has more bone to work with. That's what we wanted. But because the patient, look here, like they have a lot of extra granulation tissue, disease, and infection there, just the tooth was basically hopeless. Yesterday, I had my my braces final, and God helped me because that final was one of the hardest finals that I have ever taken. So hopefully I passed. But I felt like defeated, and I had to go into clinic right after. I was a little bit late showing up to clinic, and the patient that I opted in to help with, because it wasn't my patient, but I wanted to kind of get more exposure. Patient was due for full mouth extractions and delivery of dentures. And the patient was literally cussing the doctor off, the assistant off, everybody off. And I'm just waiting in the room. I'm like, what's going on? The patient got so much numbing, but they weren't getting numb because they were on so many other medications that was interfering with the mechanism of the anesthetic agents. So I watched how the residents and the attending doctors diffuse the situation, and the patient left happy. So I'm like, there's always someone that's going to have a worse day than you. So that literally put a smile on my face, and I'm like, okay, my final is not the end of the world. It's not that bad. Hopefully I passed. And then I moved on with life. I was checking out for lunch. The doctor was like, who are you? And like, it was a new doctor. And I didn't know that I needed to check in with him. But he's like, just make sure that you check in next time. And I'm like, okay, sorry, I apologize. And then I'm like, have a good lunch. I came back, and then I helped with a comprehensive exam. And the patient that I helped with, they had throat cancer, hypopharyngeal carcinoma. And that was the first time that I see cancer in front of my eyes instead of like a PowerPoint or whatever. And since I've been at ASDOH, I keep hearing the phrase MD Anderson, but I never knew what it was. So I kind of had the courage, and I asked the doctor, like, you guys keep saying MD Anderson. And they were like, oh, they are contracted with the school to send their patients over, and we can send our patients over to them. So back and forth, interprofessional education, basically. And that's the relationship that's going on there. So after that happened, the doctor had the meeting with my classmates, and he, like, out of respect, he left me in the room to assist until I basically left a little bit late. We ended up going a little bit over time. But at the end, I was checking out with him, and he's like, I saw how involved you were in the exam, and I didn't want to interfere and take you out of there. I think you did amazing, and good job for taking initiative and stepping in to help the residents when you really didn't have to. You could have just done the bare minimum and just worked on something else on the computer. And I'm like, that's what I'm here for. I feel like the COVID took away 6 months of my clinical experience. So now is my time to do what I can to make up for that lost time. And not a lot of people take initiative, and I think their clinical experience is going to be at loss for that. So that brings us to today. So we had DIC dentistry in the community, and then our session, we ended up watching Poor Kids, and today's lecture was about poverty. And today was just very emotional, and because some of our classmates shared their story, and they were super vulnerable. Like, some of them cried, and it was just very emotional to hear other people's background. and how they got to this point. And that's why you just need to appreciate everybody in front of you and respect their journey and how hard they had to work. They were all of them were going against the streams to get where they are today. And that brings me to a couple hours ago, right before the meeting, where I went back to the clinic. So we ended up practicing trigger point injections, which is basically trigger point injections is injections for trigger points, parts of your muscles that that create a lot of pain, and the pain radiates elsewhere in the body. So I ended up getting the trigger point injection. So the doctor demonstrated it on me and my classmates, and we basically just, and it was the best thing ever, because now like my back and my neck is so relaxed, and I have been stressed out for the past couple of weeks because of my licensure exam. So what the doctor uses basically a syringe, and she goes around needling the muscle, and that needling action basically relaxes the muscle. And once it relaxes, the anesthetic that's in the needle gets released, and that is mediated by the endogenous opiate system, and that creates endorphins, or euphoric effect, just makes you happy and relaxed. And after that, I ended up doing like neck stretches, and that relaxed me even more. So I volunteered to be the guinea pig, and I actually watched this a couple of weeks ago, done by another attending doctor, and it's dentistry that's not practiced by many. And look into it. It's called trigger point injections. And that brings us to almost the end. What if I fail? But ask yourself that question: what if I can fly instead of failing? So I believe that being the early bird, I try my best to get the worm, and showing up to the occasion, and just being proactive about how much I can do, instead of like, okay, my patient canceled, I'm just gonna go home early. I have listened to a lot of podcasts, and a lot of the graduate alumni and people that graduated already, they say if they can go back and do one thing, they would say they would have stayed at school 8 to 5 every single day to milk out or squeeze as much experience as they can. Because once you get out in the real world, there is no one watching over your head. The only thing that's protecting you is malpractice insurance, and that is one of the most expensive things that you will have to pay as a practicing dentist. So I rather, God forbids, make the mistakes, if I have any mistakes in dental school, than make them outside of dental school. So a perfect practice makes perfect. So right now I'm getting ready to take my CDC exam. It's in 2 weeks exactly. And this is basically just showing you that whatever you do, make sure that you practice outside of the box. And this, for example, is saliva ejector. You've probably seen it at the dentist or used it before. So right here, there's a blue tip. I don't have an assistant. What am I going to do during the exam? So what I did is I cut the top off, and then I ended up using the metal that comes in this right here. I created a hook, and now I have the suction right there. So that way I'm not making a mess, and whoever is proctoring the exam is not looking at me or failing me for making a little puddle underneath my my typodon. So these are things that not a lot of people do. It's the extra mile that I want to go to make sure if I'm practicing, it's the best way that possible that I can practice. I think it just makes you a better dentist in the future. So right here, this is some of my work that I have made, one of my most recent practices. So here we do a crown prep on number 3, and then number 5, a crown prep also, and then we're gonna do a bridge right here. Number 8 is a root canal access, and we end up filling that. And then number 9 is also a crown prep. And then number 14 is also an endo root canal tooth. Another thing is we have, like, because we're doing so many different procedures and we use so many different burrs, we have like 3 or 4 different burr blocks where we have the burrs where what we used, but I ended up creating my own. These are the only 10 burrs or 12 burrs that I used, and that is what I use every single time. So I made that myself. And that same exam, I ended up getting positive feedback from my clinical directors. And again, if they get positive feedback, great. If you get negative feedback, improve. It's that simple. Don't take anything to heart. You're still learning. You're still a student. And that was one of the most recent work that I have done preparing for this exam. I ended up posting this on my Instagram, and just to inspire other people to kind of just keep pushing forward. And also, I like photography, so that was a new thing that I did with the black background and all that. It just looks more professional. We're taking actually our mock next week, so I'm getting ready for that as well. So this week, as you guys have seen during my going over my schedule, I didn't have any time to practice for the CDCA because I was in the NICU clinic. So I felt like a little bit at unease, like I'm not doing everything that I can in my power to practice. But I know that next week I'm gonna have a lot of time to make up for that, and I have been practicing a lot. So hopefully I pass the mock. Hopefully I pass the actual exam. So again, like I said, think outside the box, plan ahead, because I really love this picture. Because you just need to have forward thinking and think ahead, because you need to anticipate an issue before it happens and know how to deal with it or diffuse the situation. Never forget where you're from, where you're going, and who helped you get there. So this is me again, and this is Dr. Eden. So this is the first time that I met Dr. Eden during the pre-dental visit to UCSF, UC San Francisco Dental School. And this is him coming to my school. So again, weird turns of event, it just full circle basically. He ended up coming to our ASDOH clinic when he gave the Lunch and Learn presentation, and I ended up giving him a tour around campus and all that. Amazing guy. And this is me back in 2010 as a dental assisting student. This is me during my white coat ceremony as a dental student. So again, like I said before, nothing has changed. It's just, again, maybe a little bit more swagger over the years, but still dentistry has been my passion. Nothing has changed there. DentalLyfe's tooth tips. So one day or day one, you decide. You have to be your own hero. You cannot wait until someone comes and becomes your hero. You just have to get off your butts and just keep grinding. And the best thing that I have learned this week from our attending doctors that gave me that feedback is that they told me that I'm not scared to go the extra mile or to help other people, because in that process, helping other people also helps me gain more experience. And going the extra mile, it will help you because it's never crowded. There's only a few people there. So I'm going to share this clip. This is the late Chadwick Boseman, aka the Black Panther. He passed away a couple of weeks ago. And this is one of my favorite speeches that he gave at a graduation.
Rather find purpose than a job or career. Purpose crosses disciplines. Purpose is an essential element of you. It is the reason you are on the planet at this particular time in history. Your very existence is wrapped up in the things you are here to fulfill. Whatever you choose for a career path, remember the struggles along the way are only meant to shape you for your purpose.
So I think that is very vital for this presentation, because I think my purpose is dentistry. And it shows in everything that I do, whether it's with patients, with pre-dental students, with my family. And I think it's the best thing ever. So best of luck, and honestly, or just remember the message of this presentation and everything that I do. All I ask is just to pay it forward, help 3 other people, and these people will eventually help other people as well. So questions in the comments section and giveaways. So these are my social media outlets, links, whatever you want to call it, and my email. So if you want to take a picture of that. And this has been a pleasure giving you guys this presentation. So a lot of it was vital information that I thought I needed to share with you, especially during this time of COVID, because a lot of people are just not motivated. A lot of people just lost faith in a lot of things. Hopefully I changed your mind that there's still faith there that you can grab on.
There's so much strength in you.